first signs of heart failure. So I'm going to tell you about 7 signs in your body that indicate your heart isn't doing well, because I don't know if you're aware, but when your heart isn't functioning properly, it warns you, it sends you messages. So have you ever considered that a symptom you've been ignoring might actually be your heart telling you it's struggling? And how can you tell if your heart is working the way it should? Cardiovascular diseases, including heart attacks and strokes, are the leading causes of death, not just here in Brazil, but worldwide. Here in Brazil, there are about 400 million deaths every year due to these diseases, and globally, it's around 14 to 15 million, sometimes even more depending on the year. So we're going to discuss 7 signs. A sign is anything we can measure or observe, and I'll also teach you how to prevent these problems. So go ahead and write in the chat, write in the comments which part of Brazil or the world you're watching me from right now. Those who've known me for a while have probably noticed I'm not in my usual spot. I'm here in Campos do Jordão, Sao Paulo. And you, where are you? Let me know in the chat. Tell me in the comments where you're speaking from. And also let me know, tell me if you've ever had any heart problems, because I want to get to know you better. And now let's talk about the 7 signs. The first sign, folks, is the one that appears on the ear here, which we always refer to as Frank's sign. Frank's sign indicates clogged arteries, meaning if someone has Frank's sign, that groove in the ear here, folks, right here, like a little line or mark, a small crease in the ear, it suggests they have a higher chance of having clogged arteries. Dr. John, does everyone who has this Frank's sign have clogged arteries? No, 30% of people have absolutely nothing. Now, if the person is very young, if the person isn't elderly, the younger they are, the greater the chance of having a coronary artery obstruction in both the coronary and carotid arteries if they have Frank's sign. The second sign is hair loss on the legs, what we call distal hair rarefaction, which is a sign of peripheral arterial disease. Why? If you have any arterial blockage, blood won't flow properly. And then arterial blood, which is rich in nutrients, rich in oxygen, won't be able to nourish, won't be able to provide these fuels, these essential substances for the proper functioning of hair follicles where hair grows. So in these areas, hair won't grow. The skin will be smoother, shinier, colder, and it can also be associated with slower nail growth. Want to know how we can suspect if a person has arterial blockage in one leg but not the other? If the toenails on one foot grow faster than those on the other foot. Dr. João, is that the only reason why my hair doesn't grow? No, it could be venous insufficiency, which is also a circulatory problem, or it could be due to genetics. The third sign is xanthelasma. What is xanthelasma? It's a yellow plaque usually found here on the upper eyelid, which indicates cholesterol deposits in the skin. It's more common in middle-aged women and suggests that the person likely has high cholesterol and triglycerides, which increases the risk of heart attack and stroke. The fourth sign is arcus senilis. What is arcus senilis, which is more common in older people? Have you noticed that as a person gets older, their eyes seem to become lighter, appearing grayish or bluish? So this border is actually a halo around our eye, specifically around the iris. It indicates cholesterol deposits at the edge of the cornea, which can change the eye color to blue or gray. You might hear someone say, "No way, my grandmother's eyes changed color as she got older. They turned blue or gray. Her eyes became so beautiful." In reality, this is called a senile halo. It doesn't affect vision and doesn't require any treatment. However, if it appears in young people, it could indicate severe dyslipidemia, which means serious disorders in triglyceride and cholesterol levels. The fifth sign is cyanosis, the bluish or purplish discoloration of the skin, which indicates a problem with the delivery of oxygenated blood, which is red blood. So venous blood, which is blood without oxygen, is the darker blood, while arterial blood rich in oxygen is the blood with a brighter red color, the red that we call bright red. Cyanosis can be a result of a clogged artery, emphysema, embolism, or heart failure. So for some reason, that area isn't receiving an adequate amount of oxygenated arterial blood. The sixth sign is ulcers, which are wounds that are difficult to heal and can indicate arterial insufficiency or venous insufficiency. Generally, ulcers of arterial origin are located on the outside of the leg, on the heels and toes, and don't usually bleed, unlike venous ulcers, which are usually found on the inside of the legs, on the inner part, and also tend to bleed. And our seventh sign is swelling in the legs, known as edema, which can indicate heart failure or kidney failure. So how can we identify if a person's lower limbs, feet, ankles, or legs are swollen? This swelling typically occurs at the end of the day due to gravity, especially if the person has been standing or sitting all day. First, we'll look and see that the person's foot appears puffier, fuller than usual, and another way we can identify this is by doing what we call the pitting edema test, where you'll take the person's foot. Let's say this is the foot, and you'll press your finger into it, you'll press your finger, and when you remove your finger, there will be an indentation left where it's swollen. So folks, these are the 7 signs of heart problems, specifically weak heart or heart failure. So if you're experiencing these signs and symptoms, pay attention. Don't hesitate to see your doctor immediately to start treatment and prevent the main complications of heart failure, okay? How can we prevent such a serious and common disease? The same way we prevent diabetes, high blood pressure, and high cholesterol. The same way we prevent obesity and being overweight. The same way we prevent anxiety, depression, and cancer, by promoting a healthy lifestyle. So you need to exercise, eat healthy, quit smoking, stop drinking, maintain a healthy weight, and keep your medical checkups up to date. If you have high blood pressure, diabetes, or high cholesterol, you need to manage these conditions and keep them under control. And also, seeing your doctor regularly is crucial. So if you want to learn how to prevent heart failure, cancer, heart attacks, and strokes, if you want to learn how to better manage these conditions, your high blood pressure, your diabetes, your high cholesterol, your insomnia, your anxiety, your depression, your obesity, your smoking habit, your alcoholism, if you want to learn how to improve these conditions without medication, without tests, and without doctors, I recommend you read my book, The Longevity Code, where I show you 100 habits to live past 100 years. And these habits will indeed help you prevent, treat, and even reverse many of the diseases I just mentioned. So here's what you need to do. Click now on the first link in the description or on the pinned comment and get your copy right now of the Longevity Code for just $29.90 in digital format, which is the only format available. And if you don't like the book, don't worry, I've got you covered. I understand you're spending $. You might be unsure if you'll get a return on this investment. Maybe you won't like the book. Maybe it won't be right for you. Maybe you won't be able to read it. Don't worry, if you don't like the book, I'll refund your money, no questions asked, no red tape, no hassle. Guarantee, with an unconditional satisfaction guarantee, because I'm absolutely certain that if you read the book and put into practice what's written in it, your life will change for the better. Click now on the first link in the description or on the pinned comment and get your copy of the Longevity Code now.